a lack of support there. That can be a part of the scenario, of the picture that's happening. And so that's a stressor, you know. But there's lots of support groups, mental health groups, support groups, and group therapy, and 12-step groups, etc. But to understand that it's a tension cycle of, say, the stimulation that causes the cycle to start with, what triggers you, what your triggers are, to understand what your triggers are, and to pay attention to that as you go along. You're going to do this all in one sitting, but as you go along, you know, you get to know yourself. You start to understand what's making you react. Maybe not why, but what is it? And so then that gives you ways of being able. That has implications for treatment, and so it gives you ways to be able to cope. That's the purpose to understanding this. And so to understand, for example, the stress cycle, how it starts with alarm and then it ends up total exhaustion, to be able to interrupt the cycle before it gets to, say, panic disorder, where you've lost control of the anxiety now, and now it's just, the body's just reacting and it won't calm down. And so it can become, if it's unrelieved, acute stress, a sudden stress. But if there's a relief and there's something that remedies the stress, say you see a bear, and you know, the remedy for the stress is you're out of danger, you get out of danger, you're fight or flight, and so then, you know, you calm down because the bear's gone or you're gone or whatever. You know, your strategy worked, and so. Or you understand bear behavior, for example, if you have to work with bears, and you know, so one of the ways would be to understand bear behavior, because to understand what it is you're anxious about. If you have a phobia, for example, which are irrational fears that are associated onto an object, and that could be second, third, fourth, 100 times removed from what the original was. So, you know, depth analysis may not, you know, ever come up with anything, because you know, we can distort things, and you know, these things can take forever to find out what the origin was, and it may not even be helpful. So just to understand, if you have a phobia, for example, to understand what that's about and get understanding, because anything that gets understanding gives us a sense of safety and feeling in control, because we know what to expect, and that puts us at ease right away. When you know what to expect, and you know what to do, and you know how to take care of yourself, and you have a plan, that automatically alleviates anxiety just right there. That'll take at least some of the edge off. And so knowing how to do that, getting informed about whatever it is you have a phobia about, also getting informed about, for example, phobias are an aspect of, from the DSM-4 of anxiety disorders. And there are many different as many phobias as there are things. You know, I saw the other day a guy, a short clip. This guy was for real. Evidently, he was terrified of, I believe it was tomatoes or something. I mean, you know, when he saw a bunch of tomatoes being wheelbarrowed in, he just about went ballistic. You know, just terrified, just screaming, like, you know, like it was a bear or some dangerous, horrible thing or something. So, you know, they may not make a lot of sense for what we've reassociated the fear onto. So it may help to learn about it. For example, I have like a somewhat of an irrational fear. Many of these are common in the collective unconscious, you know, as Jung would put it. Many of these fears are primal sort of fears, you know, that you had developed since childhood. They may still be somewhat irrational, but for example, a fear of spiders, you know, I have that one. You know, some people have a fear of snakes, you know, and you may put all of this anxiety onto this thing that you hate, and you may be dealing with it that way on a one-to-one kind of thing. That's one way of dealing with anxiety. For me, it was free floating, so it would just eventually escalate into a panic attack. I never really had anything to put it on. I didn't deal with it that way. I guess in my mind I didn't deal with it putting it on something, because we need, and this is research from emotional studies, that when people were given, say, a shot of adrenaline, they would look in the environment to see what was causing their increase in metabolic rate, and their anxiety level, their tension level started to go up because of the shot. You had the experimental group looking around to explain their anxiety, or the increase in their physiological levels of fight or flight feelings or adrenaline. This would cause, they would get a shot that would, say, cause the adrenaline to flow more, and they would be looking in the environment to see what's causing that, you know. Because when we are internally stimulated for no reason, for example, we're going to be looking around possibly to see what to attach this on. And so this could be partly explain phobias, partly. We're not really sure. Like I said, it's the nature-nurture thing again. But it does help to, the control group, on the other hand, the people that didn't get the shot were just normal. They weren't attributing anything to, if there was an emotionally arousing situation or anything, they didn't attribute it to that, for example. Whereas the experimental group did. They say if there was a scenario where something would raise the anxiety level, like a test, or witnessing an argument between two people, or something like that, which was all like set up by the experimenters, well, then they would think that that was the cause of their anxiety. When they later did a test, a questionnaire as to, that showed anxiety scales, for example, and causes for that. And so, it is true that when we're aroused, physiologically aroused with adrenaline, which makes everything go faster, the heart, that pumping, fear and whatever, that we will look around to try and explain this, in our relationships, in our environment, etc. And so, in that way it has survival value. When you see a bear, you take off, or fight or flight, that's what adrenaline causes you to do. It causes your nervous system to be hyper aroused and your whole body to be energized and pumped up to either fight or flight, quite literally. But when this is unresolved, when there's no way to resolve this immediately, when there's no actual present danger, this is when it starts to become dysfunctional. And so this will be turning into, say, irrational fears such as phobias, fear of heights, or fear of just about anything there is. Like I said, people are different in the way that they free associate, and their personal symbology may be different than somebody else. So, getting to the origin of it isn't as helpful, say, maybe interesting and informative, but learning about yourself, but it may not be actually helpful to overcoming it, is what I'm getting at. We need something that's going to bring down the arousal, and so physiologically. And so what's happening, if it goes on too long and it becomes chronic, it will go, as Hans Selye, the stress researcher, I said, it will go into exhaustion. And so you'll get a host of other symptoms like exhaustion and irritability and secondary worry thoughts, because you're not going to be thinking of calm thoughts or calming thoughts or self-nurturing thoughts, for example, when you're all aroused and fearful, but there's no stimulus.